As we started off Chapter 5, we explained the importance of allowing self-exploration, as it facilitates for the detection of several things that may need our attention. When we look at female reproductive and sexual health, genital self-exams are extremely important, as these are often the first times when individuals become aware of things, and then it needs to be brought over to their primary care physician so that if treatment is needed, they could catch it early and prevent death or more invasive procedures. The gynecological examinations are recommended once a woman starts menstruating or once they become sexually active. But if there's a history of cancer in the family, then they recommend that the medical checkups start earlier. Pelvic examinations, which are internal and external, so cervix examinations should start early on, and then breast examination throughout life should be done. Oftentimes they recommend that this be done in the shower, where there is water running, heat, and where the woman is able to then just go through clockwise rotations around the breast and around the nipple area, observing for any changes in skin color, nipple growth or discharge, and also any lumps that would be there. The pap smear, which is a cervical swab that was in there, it's recommended 3 years after first sexual intercourse or starting at the age of 21. And again, these are all preventative ways and how we could maintain healthy. Endometriosis is one of the most common health concerns, gynecological health concerns in women. And this has been dubbed as a career woman's disease because it is a lot more common in professional women than with women who would have not gotten a career and who had children earlier. Women who had not had children at later ages are more likely to experience this in here. And they experience short and heavy menstrual cycles that have been more found to be at risk for endometriosis. So what happens with endometriosis is that the endometrial layers, you may remember the endometrium buildup in the uterus, in the inner part, rather than depositing inside the uterus, they begin to deposit outside. And this typically makes it for a weaker menstrual cycle initially, which may not present any symptoms initially, but over time, women may start developing some symptoms in that. Those are typically painful periods, lower abdominal or pelvic pain, pain while defecating, and also pain during intercourse. This, again, because of its association with women who are career-minded and who have children or delay motherhood till later, is typically with women who are childless between the ages of 25 and 40. We do not know the cause for this in here. We do know that it can affect fertility, and the way this is mostly treated is through hormones, surgery, or laser therapy. The menstrual toxic shock syndrome, MTSS, is associated with tampon that are high absorbency. The convenience of having something that would prevent any accidents often gives way to even death, because with young girls that may not know that this could be highly toxic and deadly, they sometimes either fall asleep with a tampon for an extended period of time, which would allow for bacteria to build up in the vagina, and this could bring about even death. Some of the symptoms that are initially felt are fever, diarrhea, vomiting, sore throat, muscle ache, rash, but eventually it can result in death as it starts bringing about failure of the organs, including the kidney, lungs, and the heart. This can be avoided by changing tampons regularly, using tampons that are not as high absorbent, or switching over to sanitary pads, as that would not allow for the bacteria to build up. In the previous module, if you read the notes, there's also Diva Cup, which is rather than absorbing and allowing the bacteria to be there, it collects it in a cup, and some people say they would reduce that as well. Please note that there are a lot of cases out there with young girls who had terrible outcomes because of this in here, and so caution is recommended whenever there is a use of tampons. When it comes down to cancers of the female reproductive organs, breast cancer is one of the most common among American women. And again, early detection is essential for the prevention or the treatment of the cancer before more drastic and invasive procedures. Mammography beginning at the age of 40 is recommended, but if women have a history of breast cancer in the family, then it's recommended that you start earlier at the age of 35 or earlier. On average, the mammography can detect 80 to 90% of breast cancer in women that don't have any symptoms yet. And the symptoms are typically a breast lump, pain, nipple discharge, the puckering of the skin in the area, and also the change in the nipple shape. Again, going back to the original first slide of chapter 5, self-exploration is essential. Sadly, throughout life, this has been thought of as one of lust and sexuality, and women have been shamed for engaging in a responsible process of exploring their body. When we're looking at the treatment in here, you have either a partial or modified mastectomy, which would leave a lot of the underlying muscle and lymph nodes intact, or a radical mastectomy, which would be the removal of the breast, including sometimes the surrounding tissue and sometimes even parts of the bone, depending on how far it spreads out. Keep in mind that the cancer, if not treated, will spread to other parts of the body, so that's why it's important to catch it early. A lumpectomy, which is basically a removal of a tumor with surrounding tissue but leaving the breast intact, can also be used depending on when this is detected. If the tumor hasn't been spread yet, then lumpectomy is possible. And then there's also radiation and chemotherapy, and with each of these treatments there's risk factors, so please consult and be familiar with these in here for the exam. The risk factors for breast cancer is not to say that it causes it, but they've, again, through correlational findings, we've discovered that people who have higher fat intake, the way their aging process occurs, early menarche, inactive lifestyle, alcohol consumption, and genetics have all been associated with increased risk for breast cancer. Cervical cancer has actually decreased in its prevalence rate in American women over the past decades. The way this is detected in earlier stages is through a pap smear, and there are high cure rates for cervical cancer. There are certain types of the HPV virus that are the main cause of cervical cancer, and now the FDA has approved vaccines to prevent this in here. Gardasil and Cervarix. These basically have to be taken significantly earlier in life, so it's kind of controversial because it's recommended that girls take these vaccines sometimes as early as 13 years of age, and some parents and individuals believe that doing so would incite these young girls to be sexually active, but research does not demonstrate that. The risk factors associated with cervical cancer is, again, those who started sexual intercourse earlier, having various sexual partners without protection, teenage mothers, and cervicitis, which is basically an inflammation of the cervix earlier on, and this could be caused by allergies or sexually transmitted infections, and also various infections that can occur at the genital area. Extended oral contraceptive use has also been appearing with some regularity with women who suffer from cervical cancer, and the treatment is the treatments that are available as surgery, the removal of the cervix, radiation, and again hysterectomy, the removal of that of the uterus in advanced stages of the cancer. Endometrial cancer is one that is seen typically with some symptoms that are not that obvious. Some women sometimes have abnormal bleeding, which would be sometimes unexpected. Rather than waiting till the other 20th day, they may have spotting in between. They may have a rather heavy flow, or spotting, and because the symptoms are kind of ambiguous, a lot of women don't detect this, but it is important that they detect this earlier for, again, treatment. Now, detection is most successful with dilation and curettage, which is basically the DNC, the surgical scrapping of the uterine wall with a spoon-shaped instrument, and then this is basically sent over to the lab to assess for this in here. This is not detected through a pap smear. This is different, the DNC process. The treatment, similar to the other one, surgery, radiation, hormones, and chemotherapy. And there are good news for this one. There's over a 90% survival rate if detected early. And we also find that oral contraceptives may decrease the risk. This is a bit confusing because we find that for cervical cancer, extended oral contraceptive use is associated with it. And yet with this one here, if you take oral contraceptives, then the chances of having endometrial cancer would be reduced. So there's a lot of concern as to whether you are getting something good in exchange for something bad whenever we consume medicine or birth control. Ovarian cancer is less common than breast and uterine cancers, but is the deadliest of the cancers in women's health. Symptoms are not that many, and that's what makes it deadly, is that earlier in life, in the stage, there are no signs, and sometimes there's ovarian cysts, which, by the way, are not unusual, but they don't all result or turn out to be ovarian cancer. Slight abdominal discomfort, which again could be ambiguous because it could feel like just an upset stomach or cramps. A loss in appetite, which again could be brought about by various things. So overall, these symptoms would indicate more so an upset stomach than ovarian cancer. So that's why it is deadly. And the risk factors that have been associated with that is being childless, having early menopause, having a diet that's not healthy with high fat content, being lactose intolerant, and also using talc powder in the vulva. You may know of a lawsuit that basically awarded several women millions of dollars because for a while Johnson & Johnson promoted their powder to be used in the vulva for hygiene purposes, but it's actually turned out to be associated with cancer. So these women were awarded several millions of dollars for this in here. And also, please note that with ovarian cancer, there's a decreased risk with early age pregnancy, having children. We find that the more children that are had by the woman, the less chances of having this type of cancer. Using birth control pills, again, the controversy of having, not getting ovarian cancer, but getting other forms of that. And the detection techniques that are used are blood tests, pelvic exams, and ultrasound. Unfortunately, again, most individuals who have ovarian cancer are diagnosed after cancer has spread beyond the ovary, and this is what makes it so deadly.